Hello, my name's Dr. David Alcock and I'm the lead perioperative anaesthetist at the Royal Hobart Hospital, and I'm presenting paper number 31, Pre-operative testing for elective surgery at the Royal Hobart Hospital. At my hospital, we started to identify a culture of low-value healthcare in the pre-assessment clinic, particularly the excessive ordering of pre-operative pathology investigations. This was concerning as evidence supporting the pre-operative testing is weak, especially in the low and moderate risk surgery. To confirm this was a problem, we audited the current practices within the pre-assessment clinic. We found an excessive routine ordering of coagulation and blood group and hold testing in low and moderate risk surgery, as well as an excessive routine repeating of investigations that have recently been done by the patient's GP or even the surgical team, even when they were normal. Surveying the doctors that regularly worked in the clinic, we found that the key causes were a reliance on an out-of-date unofficial guidebook passed down between doctors. This book had no evidence base, but was the key decision tool for junior doctors making these decisions. There was also a culture of just-in-case over-ordering in an effort to avoid blame for a day of surgery cancellation or day of surgery delay. There was also no guidance or understanding as to whether or not recently completed blood tests by the surgical team or GP were still relevant for the upcoming surgical admission. In order to change the culture of preoperative testing, we identified that the key issues are a lack of an official guideline that has a good evidence base and no understanding or agreement of how old a test can be before it's irrelevant. The solutions we're going to implement are that the Department of Perioperative Medicine will write a preoperative testing guideline. We hope that this guideline will build resilience into our organisation by empowering inexperienced staff to make good, high-value healthcare decisions. The guideline will also be endorsed by the head of surgery and head of perioperative medicine. This means any issues with the decisions made based on the guideline can be taken directly to the heads of surgery and perioperative medicine, as opposed to the clinician that ordered the test. This also means that any issues identified will then be corrected for future. The other things we plan to do are endorse that any blood test that's normal and 6 months old or newer is still relevant and does not need repeating, and also educate staff in accessing other sources of pathology testing, such as the private pathology labs that our GPs often use. We expect to see a large reduction in coagulation and blood group and hold testing at the Royal Hobart Hospital prior to low and moderate risk surgery, as well as a further moderate reduction in full blood count, renal testing and liver function testing prior to surgery.